For those of you that have been to some of these, you know that we're hosting, workshops and luncheons like this on relevant topics, things that we think are important in the marketplace, and we're delivering information that we hope will allow you to really compete and succeed with your organizations and your businesses. Sometimes, what we talk about maybe is not a right fit today, it may be a fit in the future, or it may be a good fit, currently. So I don't know if anybody grabbed one of these little handouts at the front, but these are our 11 trends that we've identified as an organization for 2019. You got front and back, and kind of coincidental, not by design certainly, but the second item on this list is direct primary care, right? So we're seeing this become more and more a topic when we discuss corporate welfare benefits, health and welfare benefits of our clients. Concierge medicine, I think, has been around for a number of years. It's starting to get traction, so we're very happy to have Dr. Sharyl Truty with us. Dr. Truty has a very successful practice out in Ponte Vedra, serves the beaches and some of the Jacksonville areas. She's going to share with us some insights and really how they run their practice and what that means to organizations. She is a board certified physician practicing medicine for over 15 years, right? They left all the sick people back at the office, so we got you're done here about an hour to get back there and take care of them. She was the team physician for soccer team?
Yes, Chicago Red Stars in Chicago. Yes.
Chicago, so she's got a sports medicine background. She's done some additional study and training with acupuncture and nutrition, so she really has a very well-rounded practice. So we're happy to have her. I know she's got some guests with her. I'll let you introduce them, but I'm going to go ahead and bring you up to get started. If anybody picked up a little blue deal, I think it's lip balm, but just to kind of show you, it unscrews. We did a program a couple of weeks ago, and nobody could figure out how to undo this. I want to show you what this is. Yeah, put right in your golf bag. Yeah,
was it all men or were ladies?
Oh, and by the way, happy Valentine's Day. This is your Valentine's present from us, right? Put a little on tonight before you get home and kiss your sweetheart, right? So anyway, Dr. Truty, thank you for being here. We're going to turn it over to you. I always say it, this is your meeting, so make sure if you have questions, raise your hand. That means that somebody next to you probably had the same question and didn't want to ask it. So kind of open. If you have anything afterwards of a kind of a personal note, we'll be around, and I know Dr. Truty will be around to address those questions as well. So with that, thank you for being here.
Thank you very much, Chris. I appreciate that fabulous introduction. So thank you very much again for having me here to talk to you today. Thank you, Chris. Thank you, Joe. Thank you, BKA's us partners, to talk about something obviously very near and dear to my heart. This is the practice that I started about 3 years ago. We had our birthday a couple of weeks ago. And I, have been a physician for over 15 years, and this story you'll hear over and over, I think, with direct primary care. I was just getting burned out in the system. I wasn't able to take care of patients like I truly wanted to take care of them. I wasn't able to spend the time that I knew I needed to make a difference. And so when I was looking at business models to open, I said to my husband, I can't do this like this anymore. And thank God he was willing to, move out of Chicago and come down here where we have family and be willing to, help me start a practice. And I said, honey, I think this could be an answer to me and what I see. I think direct primary care is something. So we kind of got to know about it, became a part of the direct primary care community, and opened our practice here at the beaches 3 years ago. So I'm going to talk to you about direct primary care. I'm sure many of you have probably maybe read about it already with some of the trends. So I'm just going to talk to you about it from my perspective and tell you why I think it's growing across the nation and why I think it's worth it to understand what it is, what it's about, and consider presenting it to neighbors, clients, family members. When I first started 3 years ago, the map wasn't even this big. It was probably only about 600 practices throughout the country that had direct primary care. So in about 3 years, you've seen, a big growth in the amount of practices that have been popping out throughout the country. And here in the state of Florida, there is quite a few as well in a lot of the major city areas. It's on the minds of the legislature. Florida here a year ago passed a law that states that direct primary care is not health insurance. And for us, that was a very important step in our movement because we want to be sure that we are not viewed as insurance. We don't function well under those regulations, and it's important for us to be distinct from an insurance plan. It is on the mind of the legislature, and I'll talk about it on a federal level. I'll talk a little bit more about it later when it comes to HSAs and the membership dues being a qualified expense. There was a bill that was passed in the House and is currently now sitting in the Senate. If our government can keep running, hopefully maybe it'll be passed in the next couple of months that clarifies the HSAs and whether a direct primary care membership dues are a qualified expense. And I'll talk again a little bit about that more later. So a lot of people, when they hear direct primary care, they say, oh, you're that concierge practice. And we're really not. There's some things that direct primary care really feels is important to distinguish itself from concierge medicine. First of all, in the strictest, purest definition, and obviously throughout the country you've got people that are blending different model types, but in the purest definition, direct primary care charges basically a monthly fee or a periodic fee, that could be quarterly too, in exchange for services. So in exchange for a set of services that office provides for you, you pay a monthly fee or quarterly fee, and then all those services are available to you without really any other charges. It does not bill any other third parties. Okay, so a direct primary care practice really distinguishes itself from concierge medicine in that there is no other third party billing that occurs beyond that membership exchange. There's a few other nuances. Usually most concierge practices or fees are much higher, much more expensive. Direct primary care fees are meant to be kept on the lower end and more affordable monthly fees. Also tends to be, concierge practices sometimes tend to go into people's houses. Some direct primary care practices may do that, but in general, we try to go into people's houses through the aid of technology and not so much quite in person. So if that's all direct primary care was about, I don't know that we'd be here talking today or get that excited about it. But I think there's 3 other main reasons why direct primary care is special and why it's growing across the country. First is, I think, the emergence of the self-pay market. What type of insurance do most people have? I mean, what do relatives or neighbors or people that you know have now? I mean, there are a large percentage of people who have employer-based insurance, but unfortunately, there's a large amount of people who don't. According to a Gallup poll, about 10% of people are uninsured, and according to the CDC, 40% of adults in 2016 had a high deductible health plan, and that was up from 26% in 2011. So we're seeing a large trend where even though people might have insurance, they have a high deductible plan. A plan that probably has a deductible of $5,000 to $10,000 or more. And so they're paying cash on a regular basis for the basic services that they use. And so if you look at that, that's almost about 50% in a sense of people who are paying cash for a lot of the basic everyday services that you need for healthcare. So I think that has created a change. And so I think as a result, the healthcare experience is asking to be changed as people are paying cash. So let's talk a little bit about what a typical healthcare experience is like in the system. I worked in it for 15 years. I know what it's like, right? First of all, if something happens, how many of you probably try to avoid seeing the doctor at all costs, right? You know, you go to Google, right, Dr. Google, and he tells you, you know, what's going on, and you try to figure it out yourself. And you go maybe to another provider, like a chiropractor or your pharmacist, and you try to figure out what's going on before you go into the doctor. And why is that? Because the experience kind of stinks, right? I mean, how long is it going to take you really to get into your doctor? You know, it's probably, if you have an urgent issue, you're not going to get in the same day or the next day. I mean, maybe you're lucky and your practice does, you know, have slots for that, but a lot of times, no. And if you have a question, you're probably not going to get a call back that same day. It may take a while if you get a call back at all, you know. So people have to wait weeks before they can get in to get their issues addressed. Their other option is to go to an expensive urgent care or ER. And so they don't have a lot of choice as far as that's concerned. And then once you get there, I mean, how much time do you really spend with the doctor, right? It's probably only about 10 minutes. And that's not including the wait time, right? Most of us probably wait at least a half hour. You know, maybe if you're smart, you book the first appointment of the day, and so you're in and out right away. But if you don't have a choice, you're probably waiting. We had patients waiting in the room, honestly, sometimes an hour, you know, and that takes a lot of time out of someone's day. And then we're only able to spend 10 minutes. I mean, if you haven't been able to go to your doctor very often because of that time commitment, you probably have a list of things, right? And that's usually what's happening. And then you come, and that only leaves like 5 minutes, couple minutes for the doctor to talk to you about maybe 3 or 4 things. So that only leaves time to write a prescription, to, you know, write a referral. There's not a lot of time to go over medicine options, what choices you have, what cost there is associated with them. So most of us know this. Most of us experience this on a regular basis. So direct primary care asks the question, you know, can healthcare be different? And should healthcare be different? Should it be different than this? Is this really acceptable? So one of the basic tenets of direct primary care is really to have a personalized experience with their physician. You know, it's hard to put into words the value of that. It's hard sometimes to describe it. So, you know, sometimes, a lot of times I tell people, you just have to experience what it's like to understand the value of getting to know your patients really well. But in this type of model, the doctor can spend as much time as they need to. All of our visits are a half hour. And, you know, if you tell me you need longer, 45 minutes or an hour, we're going to schedule that for you. We're going to take as much time as we need. And maybe if we don't finish it in the office that day, we can finish it by phone later on the next day if we need to. We only carry a panel of patients that are about 400 to 600. Most regular primary care practices have panels of patients about 2,000 to 4,000 per provider. And here our panels are much smaller, so we're going to get to know you a lot better, understand your health history, understand the background you come from, understand what things are important to you in making healthcare decisions. So that all sounds, you know, great and nice, but, you know, and warm and fuzzy, but does that actually translate into outcomes? And the answer is yes, it does. The British Medical Journal published a study from one of the bigger companies out west that said that their direct primary care membership, patients enrolled in that, had 66% less specialty visits, 65% less ER visits, 82% less surgeries, and 35% less hospitalizations. I mean, that's huge if we can avoid you having to be hospitalized. if we're able to take care of you and know you better and prevent issues from occurring. And from a financial standpoint, obviously that translates into cost savings. If we can avoid these costly things like going to the emergency room or being admitted to a hospital. So again, direct primary care tries to answer improving quality to the consumer through this very personalized medicine that translates into very good, improved quality of care. But we also make the care convenient. So we're not shackled by an ancient CPT coding system that doesn't allow us to see patients remotely. Yes, there is telemedicine now, but there's still a lot of restrictions and things that are trying to be understood. With this model, we can see you remotely. We can talk to you on the phone and have a regular office visit, because that's just part of the model. We can see you, if you're in California and you're traveling, we can do a Skype-like visit that's HIPAA compliant and be able to take care of you wherever you are. So we're really, at this model, bringing medicine to more of a convenient level. And we try to communicate and coordinate things, help you to navigate the system, because there are many hospital systems. Some hospital systems sort of like to keep you in their system and not really show you what other systems are able to do and able to provide. And we can kind of help you to navigate that system and to find, different options that you might not be realize are in the community. And the final reason, that third reason that I think direct primary care, and I think that this is most important with anybody obviously dealing with financial, is that it provides cost efficiency and it provides price transparency. So the goal is to reduce overhead and to reduce cost. And again, we do that by trying to provide the patients, members of this practice, with services that will provide cost efficiency. So for most direct primary care practices, and there are exceptions, it includes your flat, affordable monthly fee includes all primary care visits. It includes all procedures are a part of that flat, transparent monthly fee, and that's certainly the case in our office. It includes all email visits, all telephone visits with the doctor. What we do to provide a service, again, to our members and help improve cost efficiency is we go out into the community and we have created discounts on labs. So you can get labs a lot cheaper through our practice than if you were able to go out on your own. We have found where the cheapest prices is for radiology, x-rays, MRIs, and things like that, and we bring that to our patients. In some communities, we're able to work with other groups in the community and negotiate pricing that is even better than what individuals can get on their own. And that extends to, even prescriptions. In our office, we provide wholesale prescriptions in-house, again, trying to provide cost savings to our patients. We also provide a specialty consult service. So again, the more we can take care of your issues in our office, the less you need to get care outside of that, the cheaper, obviously, the cost. So if you have let's say, a issue that an endocrinologist we might need some advice on, I feel very confident as a primary care doctor to take care of certain things to a certain level, but occasionally there are things that I understand but might need a specialist's opinion on, but I can still take care of and manage the things day to day. And that's where the specialty consult service that we have at our office helps to provide, help in that area, because I get real answers from a specialist, then I'm able to keep the patient and take care of them and manage them with specialty guidance. Obviously, if a patient needs a procedure, if they need something like that to be done by a specialist, or the patient just prefers to see a specialist for whatever reason, they can do that, they have the ability to do that. But for some patients, you know, that is a barrier, and they really want to try to keep everything in one place as much as possible. We also provide 24/7 around-the-clock care, and so that's another way that we provide cost efficiency. So instead of people having to go to an urgent care, instead of people having to go to an emergency room on a Saturday night or a Sunday, they just call our office and we take care of them. You know, if we can, we take care of them by phone. Obviously, if we need to meet them in person, we'll do that. We'll go into the office and meet them and take care of it. So again, reducing costs from the standpoint of avoiding hospitalizations, emergency room visits, urgent care visits.
Dr. What are some kinds of things that you wouldn't be able to take care of on an emergent situation?
So let's say if I had someone who I thought maybe had appendicitis, you know, so you know they have right lower quadrant belly pain. I meet them in the office. It's really tender. They have a fever. You know, then that would be something that yes, they would have to go to the emergency room in order to be able to see. You know, but sometimes people come in, they have abdominal pain, and it's really they worry that it's appendicitis, but it's not, and that's how we can avoid, you know, them having to go in.
Yeah, if I cut my arm off, I'm not gonna.
No, you're cutting your arm off, you're going to the emergency room.
Well, it's interesting because, you know, we work with certainly a lot of corporate benefit clients, and, you know, depending on the size of the group, we get reporting.
Right.
And when we see an overutilization of ER, right, when we go out and do education meetings and open enrollment meetings, you know, we talk about that, and we find out in a lot of cases, yeah, I use the ER when I didn't feel good.
Right.
Right?
Right.
And because they don't have a primary care physician, don't have a great relationship, so that, and we know statistically that an ER visit, while the individual doesn't pay this,
Right.
it's a $3,000 to $5,000 hit to your healthcare plan.
Yes,
Right.
exactly. And nowadays, more and more people, you know, even with insurance plans, their copay to go walk in the emergency room for them is $200, $500,
500,000.
1,000. And so, you know, that's really something that for a lot of people, you know, is a big hit.
Yeah, just last week we stitched up a 5-year-old. So
And that was
stitches that, yeah.
And so that would have been
Yeah.
sit in the ER.
Right.
7 in the morning.
With a
Yeah.
Band-Aid on or whatever, and then
Right.
they get to it, they stitch it up, that'll be $1,000 or $500 copay.
Right.
And we're gonna bill Aetna or whoever,
Right.
our $5,000 ER.
Right, exactly. And, you know, on a Saturday night when a woman has, you know, let's say a urinary tract infection, you know, not to get too much information here, but obviously, you know, where are you gonna go if the urgent care is closed, you know, at 8:30? You know, you're gonna go to the emergency room for something that you wouldn't normally do.
Yeah.
You know, so.
Great one.
So again, just to summarize, you know, we think that direct primary care is growing because this emergence of the self-pay market, a consumer-driven demand for quality, and the cost efficiency, and I'll say the price transparency. I mean, how many people really know how much an X-ray costs, right? If you get a prescription and your doctor tells you go here, do you really know what that cost is? You know, not till you get the EOB after you've gone there do you even really know, and you don't know that maybe this facility charges one price and this facility charges another. It's really difficult to get that information, especially if you're, you know, shopping yourself. And we, you know, help to provide a way so that you've got another person helping to shop for you to get answers to those questions. So we believe that the core in the direct primary care's values is we believe that medical care should be personable, convenient, accessible. Our goal should be to avoid unnecessary testing, minimize medications, and save the client time, and to reduce cost. So a lot of people, you know, will talk about, so we talked about direct primary care as a model and as what it is able to do. Obviously, to an extent, it doesn't do everything because there still needs to be a catastrophic coverage piece. That's, again, we are not insurance. We don't want to be insurance. So there still has to be some kind of a solution for catastrophic care. Some people do join our practice and don't have anything. I mean, they just choose to use this. And obviously that's an option. But obviously we're looking for options so that we're not going to see anybody, end up with a situation where they're in a lot of financial difficulty because of healthcare bills. So it does work with your basic employer plan. Obviously, people can have good employer-based insurance with a very low deductible, still be a member of a direct primary care practice, again, for the quality and the convenience. But it really goes very well for people who have high deductible plans. I mean, if you have a deductible that's $6,000, $10,000, again, you're paying cash. In a direct primary care membership, you have a flat monthly fee, so you know what your expenses are pretty much going to be on a regular basis. And then we're going to help you to navigate that system to keep your costs low, your prescriptions low, and any imaging that you need as much as possible. So it goes really well with high deductible insurance plans. There's two other plans though that are kind of a little unique that I've been seeing out in the marketplace. One thing that they've been coupled with is short-term insurance plans, and another thing is health shares. So short-term medical plans, I mean, obviously, I've seen people coupling direct primary care with short-term medical plans because obviously, if you have a pre-existing condition, that's always going to be a pickup in a short-term medical plan. But if it's a minor pre-existing condition, I don't care whether you have a pre-existing condition. You join my direct primary care practice, you have hypertension, I'm going to take care of that. That's not something that necessarily even needs catastrophic care or coverage. So for a lot of people, that's an option. And then you have the short-term medical care for obviously a new diagnosis, a new cancer diagnosis, or some kind of traumatic event. And then you have your existing, medical conditions cared for by direct primary care. So obviously there's holes in this model, but for some people who are looking for alternatives and due to the high cost of individual plans, this can really be an option for some people. The other thing, though, that is emerging in the market is health shares. How many of you have heard of health shares? Okay, so, a health share is basically a group of individuals that agree to come together to help each other pay their medical expenses with the goal of keeping everyone's costs low. So it's not a health insurance, but it's a health share. And, this grew out of the Christian church movement. But now a lot of these healthcare groups are large and they span several states. And so they have the financial capital to cover quite a bit of people's medical expenses. And so it's certainly something that we talk to people about as an option if their individual insurance plans, the cost of an individual insurance plan is prohibitive to them. Here is something that can provide, some type of coverage for catastrophic care. We particularly like Sedera Health, and I would take note of them. They've really embraced direct primary care, and they actually offer discounts on their monthly health sharing amounts if you're a part of a direct primary care practice. They recognize that they've seen the trend of direct primary care practices throughout the country keeping expenses down and expenses low. And so as a result, any member who joins their health share and joins a direct primary care practice receives a better monthly sharing fees. So we talk a lot about this to our patients as an option. So just to circle back, I know a lot of people are going to be interested in the HSA. Just to give you a little bit of background, when direct primary care was just beginning, there was a decision letter put out by the IRS that viewed direct primary care as a second plan. Obviously, the state of Florida just passed a law that said you're not an insurance plan. So here we have federal and state regulations in conflict. So the best way to get it clarified is to pass a bill. And so that's, again, HR 6199. It clarifies the IRS code. And so we're waiting action of it in the Senate to see if it will go ahead and pass and be able to clarify that DPC is not an insurance plan and therefore should be able to be covered by HSA dollars. Right now, we tell people to just check, obviously, with their financial planners and people like that to talk about the risks and benefits of using HSA dollars for membership benefits. Now, you can use HSA dollars for anything that I prescribe. So, you know, if I write an order for tests, if I write a prescription, you can use HSA dollars for that. FSA coverage, there's no issue. The membership fees are considered a medical expense and they're covered. So there's no issue with the FSA. And I put on here, this is the DPC Frontier and DPC Coalition. There are obviously large groups throughout the country that are made up of DPC people and providers and lawyers who are watching as things change and as laws change and keeping us up to date on what we're able to do. So it's a great resource. So we've talked about direct primary care as an individual solution. I want to spend a few minutes to go over direct primary care as a business solution. So again, we have the care piece with direct primary care, and we have the coverage piece, which can be almost anything with individuals. For businesses, you know, what are our options? What can we take a look at? You know, and there's a lot of things emerging in the market right now, and there's a lot of new and unique ideas that are out there. Again, because direct primary care can provide that cost efficiency, there's a real potential for it to be able to provide savings for business owners in their arena of health coverage. Some people in businesses will just, if they're a small business, they may use a direct primary care membership as some type of benefit. If they can't afford a benefit, a health insurance benefit for their employees, especially a lot of the smaller employer groups, they might purchase a direct primary care membership for their employees just as to provide them some type of health care benefit, and then let them go out into the marketplace to look for, you know, some kind of catastrophic coverage. Some businesses will use direct primary care as an executive benefit. So if you travel a lot, if you're, you know, obviously a busy executive, you don't want to spend time, you know, wasting time in a physician's office. You want to be able to, you know, have access everywhere you go. So there's a lot of businesses that will look at that quality, that personal care, and really use direct primary care as an executive benefit. And as us as direct primary care could take it to a higher level of wellness, you know, doing things like, you know, EKG screenings and all different types, you know, of wellness and executive wellness screenings. The possibilities are large when it comes to that.
Do you offer any, not to interrupt, but you know, Mayo has their executive physical program.
Right.
But on what your age is, you go there for a day and they do everything.
Right.
And it's a $2,000 to $5,000 number or more.
Right.
Is that something that your practice could put together, kind of a one-off or one time?
Yeah, I mean, it's something that we would probably be able to put community resources together to provide something like that. We sketched out some preliminary plans on that already when we've talked to some businesses in the community. Obviously, we can't do it on the scale that Mayo can do it, but there's definitely a big possibility to be able to do it on a smaller level with stress tests and nutrition and diet planning and all kinds of different labs. So absolutely, there's an ability to be able to do that, and that's the key with providing it as, you know, again, this executive wellness benefit. Just another housekeeping item. There's a passage of a bill, HR 34, it was called the 21st Century Cures Act, and according to the DPC Frontier, that really clarifies that employers with under 50 employees can pay for DPC pre-tax without a concern of a fine. And I put again the reference for that if anybody wants to look into that further. So I think this brings me to, I think, the crux of what I think direct primary care has the ability to help employers. It really comes down to, obviously, self-funded plans. I mean, in your traditional insurance, there is not a place to put, direct primary care, but with a self-funded plan, it really can provide a unique opportunity. So obviously when we think of self-funded plans, we think of large employer groups, right? 75, 100 or so. And direct primary care really can provide, have the ability to provide cost savings for that employer. If they enter into a self-funded plan and they have a direct primary care practice that they have their employees go to, and that direct primary care practice could decrease utilization of emergency room, of specialty services, then, and ultimately at the end of the year, the employer is going to save money on that, and that money is going to go back, into the employer and into the employer's pot for next year for health care coverage. There's large companies out west that are doing this. Nextera is one of the companies that has shown in studies of comparing, self-funded plans with a DPC program and self-funded plans without a direct primary care program, and how the DPC practices are able to save quite significantly costs. So there is a real, opportunity. It takes a lot of work. It takes obviously looking at something different than obviously a traditional plan option. But there's a tremendous opportunity. Obviously, you guys probably know much more about self-funded plans than I do as a physician. But I want to bring up that it's even being looked at for the small employer. I know a lot of people look at it for the big employer, but Allied National and their Freedom Plan, they're rolling direct primary care with their Freedom Plan out to small groups as small as 2 to 130 employees. The average size being about 50 to 20 employees. So there's a podcast, DPC podcast, episode 15, that if this sparks an interest in you, I would recommend listening to and seeing how they're bringing that to small groups. So, we've tried to position ourselves here in the Jacksonville area to be ready to be able to get involved with businesses of any size. I think there's a tremendous opportunity. It's hard, though, to really understand the value of direct primary care unless you're in it yourself. To experience it day to day, for you to be a member, all of the stuff that we've talked about, makes logical sense. But when you're also looking at it financially, it needs to make sense from, I think, a quality or yourself. And so, we have always been open to, talking to people about it, no matter who is interested in it. And, just as other direct primary care practices throughout the country, when they have a business that approaches them and are really interested, we don't have any problem providing, the owner of the business, a membership for a year so that they can really experience it themselves, because I think it's hard to really understand its value unless you are involved in it as well. And we've put a lot of things in place to be ready for should any employers be interested to kind of be able to craft something. So we're looking for partners in the Jacksonville community. We're looking for any opportunity to be able to speak, to talk about what this is and how it might be good for individuals. And we're looking for anybody who's, understands the business world in the Jacksonville community and can understand how we can bring something that's emerging throughout the country here to Jacksonville on a business level. And I'm sure some of you may have some thoughts and questions when it comes to that. So again, these are sort of all those pieces that I presented. Direct primary care, it's personalized medicine, it's convenient care, it's cost efficiency. The coverage, again, unique ideas on the individual level, our short-term plans and health shares, and with business, the idea of a self-funded plan. So this is me. Again, as Chris said, we provide a little bit unique, larger set of services than maybe your average direct primary care practice because of my training in sports medicine, because I have a lot of training in women's health. We provide a lot of those services in addition to basic primary care. I'm board certified in sports medicine, so we do a lot with that as well. I have been trained to take care of children, so we have young children, obviously, all the way to older adults in our practice. And I have special training in integrative and holistic medicine. I have trained with Dr. Andrew Weil, and we offer hormone replacement therapy, herbal options. We do a lot in functional medicine and acupuncture, and we're even going to be rolling out some IV nutrition. So we have clients who just want pure, basic, conventional primary care, and Amanda and I work on delivering that with that personalized approach. But we also have patients who are very much interested in more of a holistic provider. And so we basically have sort of two plan options to fit those people. These are, though, our individual plan prices. So, as most direct primary care practices, when we look at offering something to a business, if we have a business that is 10 or more, we provide even better discounts, because we know that what we do with direct primary care is we eliminate the middleman, so there's less cost for us. So we pass that on to businesses that want to be able to provide direct primary care and purchase that for their employees. Again, Amanda is my provider here at the practice, and her and I are located at my office. My email is there if you have any questions. We do 10-minute free meet and greet visits for anybody who's interested, because we know that this is such a new idea that we don't want people to be afraid of it. We want to explain what it means to them individually, and then if they decide that it's right for them, they can join. We also only require a 90-day commitment. I know there are other practices in Jacksonville that require a year commitment. We only require 90 days because I want people to really feel comfortable with us, and if it's not right for them, that's fine. So that is us in a nutshell. I'm sure there's some questions.
No, great stuff. I'll just comment, we introduced this to a couple of our corporate benefit clients, and they're still trying to think through the dynamics of it, but